Hello, everyone. I'm here again today with Dr. Stachowicz,
Good morning.
board certified plastic surgeon that we've been speaking with about various topics related to breast cancer, your cancer diagnosis, and moving forward from there. So today we're going to be talking more about the options for treatment from surgery, chemotherapy, radiation, and talking about that a little bit more in detail. And I think what's helpful to be able to talk to a surgeon about this is sometimes when you're at your own appointments or an appointment with a loved one or a friend, it's hard to think about all the things you need to ask. And so hopefully this will maybe make you think about some other questions you might have or just clarify some things as well. So I'm going to go ahead and let you get started.
Okay, so coming back from the last episode, we've sort of identified a few things to get ready for your consultations. So one of those key elements is bring someone with you. So this is just to reinforce the message from last week. Generally speaking, the big picture for cancer treatment, breast cancer treatment, is that ultimately, once the diagnosis is made, once the meetings of oncologists and surgeons and geneticists and all the other surgeons, including plastic surgeons, take place, some sort of a plan of treatment will have to be generated. So the general speaking options are either treatment that is breast preservation, such as lumpectomy, or mastectomy. There's some types of mastectomy, but generally speaking, either some of the breast is removed, the rest of it's preserved, or all of it is removed. Either treatment involves some degree of lymph node evaluation. And again, that's not necessarily relevant to the reconstructive or other aftercare issues, but that's just part of the picture. That is, some nodes are removed only to sample them, and some nodes are removed completely, and that all depends on the situation.
So basically, are those lymph nodes removed to test and make sure that it hasn't spread, gone somewhere else to make, what?
Correct. So generally speaking, the most common procedure with lymph nodes is sentinel lymph node biopsy. So you identify lymph nodes that are the most likely to be responsible for drainage of the breast. And if they are clean, i.e. free of cancer, then you have a very, very high chance that all the remaining lymph nodes are also clean of cancer. That means that the breast cancer did not spread. So in other words, once that plan is being discussed, you, as we mentioned last week, there can be equivalent options. That is, you may have equally good long-term survival rates with lumpectomy and radiation, because typically with lumpectomy, radiation is always part of the treatment.
Right, which is always good.
Or maybe you choose to do mastectomy and no radiation. Either of those methods may involve chemotherapy, sometimes even before surgery. So again, all that plan is typically reviewed ahead of time, and some choices need to be made.
And it is an individual situation. So again, like you've said, in prior conversations, don't compare yourself to others. Don't compare your situation to others, because everyone is different and everybody's cancer is different. So.
Absolutely. So at some point, the decision may be, it may seem that one day you feel that one option is better than another day your option is better, from another angle. Again, it's important that you discuss this with your general surgeon, i.e. from the cancer perspective. What is their take on that treatment? But then also, if you have those 50-50 type choices, this is where plastic surgery and reconstruction comes in. I mean, we typically would not be involved in reconstruction with lumpectomies. This is where you save some of the breast. They may end up showing up for secondary consults a year, 2 or 3 down the road, once the radiation effects and other things take place, to correct some asymmetry or unevenness. With mastectomy, typically standard of care is immediate reconstruction. That is, the mastectomy takes place, general surgeons step back, and then plastic surgeons would perform the reconstruction. In which case, discussing it with plastic surgery is important before the actual surgery takes place. So again, we're getting into the two sort of a big types of treatments, right? So it's either lumpectomy typically involving radiation plus minus chemotherapy.
Okay.
And then we have mastectomy. Typically, if the cancer size is of certain type, then no radiation, and again, plus minus chemotherapy.
Okay.
And then, once that plan is crystallizing, then again, another sort of a reminder of how to get ready. It's sort of time to use, not only look at the date of surgery, but also figure out who's going to take care of kids. Even if surgery is advertised as outpatient, that is a whole day affair.
And I think
so it's important to know that you have to have some backup plans, right?
And having those plans in place ahead of time, childcare, like you said, any household related activities, items, things that you need to just make sure that even the little things like bills are going to be paid, and because once that surgery happens, you just don't know how you're going to react, and it may mean that it might take you a little longer to heal or recover, even if it is a lumpectomy versus a mastectomy. I think it's just important to have all of that in place, and that's when it is important to reach out to your friends and family. And I know a lot of us are really guilty of wanting to do it ourselves, especially women and mothers. We just think that we can do it all, but it's important to remember that that's the time to reach out and get that help too.
Right.
So.
What else? I would say more on that, and it cannot be overly emphasized. Pretty much, I would say that the first week after surgery, regardless what it is, I would plan on doing nothing other than simply taking care of yourself. Even the activities of recovery, let's say we have a situation where drains are involved, planning out about getting the appropriate garments ready.
That would be our heart and
the
core
sports
bra.
bra,
Yes.
right?
Our
Another, things like thin maxi pads, which work as great padding and dressings for then subsequent changes. Say you take a shower and then this stuff that was given to you in the hospital was no longer there. Something for padding. All those questions need to be asked of your surgeons, your plastic surgeon. What are you going to do with the drains? Well, they will be typically there for at least a week. So again, that kind of planning needs to be involved. You're not going to be driving a car probably for at least a week.
Right.
So in other words, social engagements that require wearing specific types of clothes are probably to be canceled. Again, if you don't want to make your life miserable.
Right.
You will be tired.
Yeah, absolutely.
Even 1 hour of general anesthesia creates a situation where we recover for some days.
Yep, absolutely.
So all that is sort of the big picture.
Yep.
Again, to review, take notes, prepare your questions ahead of time, figure out who's going to drive you to the hospital, ask the plastic surgeon what is he planning to do, how long it's going to take.
Yeah, all of those things that takes a lot to comprehend and understand and plan. So by being proactive, having someone with you to take the notes,
Absolutely.
And making the decision that's best for you. And that's another time too where be careful in reading too much about what other people are doing or what they're suggesting or what the trends are. You really need to think about what's going to be best for you personally. I think that's really key for people to remember, and that this is about taking care of themselves and what's going to be best for them in the future, and not just about what a friend or a loved one has gone through and done, because everybody's experience is going to be different too.
Absolutely.
So I think it's just important to understand what the radiation involves, what the chemo involves, whether you're having a lumpectomy or a mastectomy and reconstructive surgery or not having that. Just understand the ramifications of everything, and question your doctor once they've said, hey, that we think this is what's best for you. Make sure you've questioned it completely to make sure you are comfortable with your final decision. So.
And then just a couple practical things.
Yes.
Typically, before any surgery, there would be no aspirin products for at least 7 to 10 days.
Okay.
So even if the surgeon did not tell you that, because sometimes we do forget as well.
Yeah, good to know.
So no aspirin products.
Okay.
No eating or drinking after midnight on the day of surgery.
Okay, so
And
like the prior night before.
yeah, so night before. That also means no chewing gum.
Okay.
Surprisingly, that generates enough saliva to fill your stomach.
Oh, wow.
So then when you're going to sleep, you're at additional risks, and anesthesiologists don't like that.
Right.
So those are just a couple basics.
Okay. Well, that's very helpful information. We'll be talking in more detail about reconstructive options for those that take that route. There's obviously people that have mastectomy or a double mastectomy and choose not to do that, which is obviously their choice and fine too. And then we'll talk more in detail too about post-surgery care in our next couple of segments. So
Absolutely.
So thank you for being here today, and please let us know if you have any questions. You can always message us through Facebook. We are Heart&core, spelled out, and the Dr. Stachowicz is Authentic Plastic Surgery, which you can also find here in Minneapolis, which you can also find through Facebook as well. So thank you.
Thank you.